Hello everyone, I welcome you all to this channel. I My name is Ipa Sandra Iveren, um MBBS Bisut. Um I welcome you all and compliment of the season to you all. This is the season of most professional exams, like final exams especially. Like this time, like this last year, it was like I was in the hot seat, and I could remember that for the past 5 years or 6 years I've not been like having celebrations, because most of the times when it's holidays I used to use it as an opportunity to read, get to cover up a lot, and also get accustomed to going to the wards and the emergency unit. Because right from the time that I was in 400 level, I had the mindset that of being a doctor, medical doctor, that a medical doctor always now like has emergencies. You'll be called out anytime to save lives, so you need to be now like appraised with that fact and work towards that. So I tried a lot as much as possible to read during this time. I congratulate you all, especially those that are preparing for their final exams. Most of the final exams normally come up in January, February. So most students, like most final year medical students, are always trying to read hard. I tell you, most professional exams are always very difficult, but I tell you, the most difficult ones are always the final exams, because it's just like an exit. So we have three fields. I'll now like give you some tips, some guides. I mean, not the guide in that text guide, like, but a kind of now like a tip that you'll be able to cope with during this season. I know it's like very difficult because this season is like a kind of being able to acquire knowledge and also coping with the outdoor celebration. Someone can come to your place and now like tell you to go for an outing, or maybe trying to help in the chores at home. It's not very easy to do that. So I'll give you some few tips. And also this um tip is not also only for those in final year. So I'll start with those in how I was able to cope from 400 level to 600 level, as well as 500 level in between. So before I'll come down to the final year guys that are preparing for their exams. So the first fact is that you need to know that this is a very difficult field. That I'm not just trying to procrastinate, but I'm trying to go on to tell you that the reality is very difficult. It's not very difficult in the fact that maybe you are cracking your head, but it's a field that at first I was thinking is the field of those that are only intelligent. But in as much as you are intelligent in this field, you need to be someone that is able to persevere and endure, because it's field that will take a lot from you. That's just the fact. And also it demands a lot from you also. So I'll tell you some facts of about how it's you can cope during this period of your clinical year. Because when you are in 400 level, you are now starting clinical activities. So the first thing first is that you need to get the text, because you need to acquire knowledge before practice. In as much as you're going to acquire the get the text, you need also the equipment, because without equipment you won't be able to work. So the text, how I was able to read is that apart from the text, I was able to get so close to the emergency unit, as well as the wards. Apart from coming for classes like lectures, also there's a lot to learn in the emergency. There's a lot to learn in the wards. There's a lot to learn during clinics. So you need to participate in all of this. If you don't participate in any of them, I tell you, you'll be lacking during the exam, and it will be obvious. Your performance will show very well that you didn't attend anything. So you need to be in line, like participate fully, because I could tell you it down on me when I was in my final year. That's during the mock. The lecturer, that's the doctor there, the neurologist, I want to now, like, I don't want to call his name, but he now brought up an exact real life question in the clinic. And I could tell you the fact that 80% of his questions were from clinical activities. It was not like if you don't attend any of the clinical activities, it will show. And it was not only in his field, because obviously he was the HOD. So all the questions that they now like agreed to be able to now like reach us, like to write or maybe to be able to answer, was from clinical activities. So it was showing that students that don't attend clinical activities, they are like deemed to fail. It was just like obvious. And also lectures are very important. And I could tell you it's not easy to cope. It's never easy. Nobody say it's not easy. The topics there are very cumbersome and they are difficult as well. Not to talk of the clinical activities, because I'll tell you then during my own time, when I go to class from 5 to 6 a.m., when I leave class sometimes 4 a.m., going to the wards from 5 to 6 just to participate in the nurses wards round, to see, at least to have an idea on the patients that are there, the patients that must have been admitted, that's the previous night, because some patients like come up newly waiting to see the consultant the next day, like during ward rounds. And sometimes when you are not like appraised with the fact that you know a summary on the patient, it won't do you good during the consultant ward round. And apart from that, you won't do good to yourself, because when that interval of 5 to 6 a.m., if you can have a kind of a hint, or let's say better still, the summary of the patient, then when you go back and open your text and now like get a clue, not even, I'm not just saying that in depth or detailed reading, but when you get like the signs and the symptoms and also like the investigations, then a kind of now like maybe when you go down to know about the management, it will save you a lot, because at least you have an idea. So when you now come for the consultant ward round by 9 and then maybe to 2, you'll be able to have like a kind of participate very well in the teaching rounds as well as the grand rounds, because the consultant will now like have to teach you and interact with you. So when you interact with someone and that person cannot be, is not participating, it's kind of discouraging. So, and you yourself, if you cannot like be able to learn so well during the teaching grand rounds and also the ward rounds, I tell you, you won't be able to learn anything, because when you sit alone and read from morning to evening, you won't know what is there in as much as when you participate in the ward rounds. So I encourage you all to get your jotters, your hardcover jotters. Try to read, like get it hard covered, so that even after 2 years, I tell you, some of my learning resources are hard covered. So during my final year, I have to get like 6 of them back, like in my own back. So I just had to keep them together and I started revising. And it was a whole, it's just like everything was very easy for me, because I was now like trying to get a revision of what I've read. Then apart from that, in the emergency, sometimes when you go to the emergency, you face some cases real life, and as they are coming in fresh, you are seeing it. You are seeing how the doctor will be able to now like ascertain the clinical diagnosis. You see how investigations are being sent. You see how they are being managed, stabilized before they are being moved to the ward. So when you are seeing all this, I tell you, it gives you a kind of confidence. And when you go back to the hostel, maybe 11, 12 p.m., 11 p.m. to 12 a.m., you'll be able to now like read what, though it's not easy. Sometimes when you go back to the text, you see that maybe you've covered 20 topics that day. That's as seen in the cases. That is impossible if you are going to start reading all night. But if you have the hardcover textbook also jotter for emergencies, then maybe during the weekends you can even if it's 2 hours, you can now like be able to revise it, get like a kind of hint on each one. It will help you, because when you do that for 1 week, 2 weeks, 4 weeks, you some of the cases are repeating themselves. You yourself, you are developing your skills as a medical doctor, because you are be able to now like know how to manage some cases. Then you are doing good to yourself, you are doing good to your also your studies also. So you need to help during lectures also. Try to attend lectures, and after the lectures try to now like revise what you've read, what you've been taught, because sometimes when you go back you won't be able to read them because you are tired, you are trying to go for calls. When you come back from calls, you are now trying to arrange your clerking for the next day. The cycle continues, and you keep on piling up work for yourself, and it's not just one field you are facing. The other fields too are there waiting for you. So I tell you, it's not easy. So you need to take it like a stepwise, a step by step. Then lastly, for those in the still early clinical years, I encourage you all, it's not a crash program. You need to start preparing for your final exams now. Like, get the book that you're going to use it for 3 years. Get the edition, the in as much as maybe you are not able to afford the present editions, but try to lay your hands on the present editions, not the old ones. What I'm saying is that some authors keep on publishing their new editions, and as they are publishing new editions, they are adding some kind of highlights or removing some. So sometimes when you are in the viva exams and you're trying to give the old fact to an examiner, most of the professors, they read as well very hard. So when you're trying to now like portray am with confidence, and you're now going to argue with the examiner, no matter how you are confidently arguing the wrong thing, it's risky. Though sometimes when you can be able to get along, it's good, but it's risky depending on the examiner. So I encourage you to be on the safe path. You need to get on the recent edition of textbooks. Get it. I guess the Badger is the one I used. I used the fourth edition, but I realized there is a fifth edition at the moment, and it's like a kind of different from the fourth edition. A lot of differences. I was able to compare, and I saw a lot with comparison. There's a lot of differences. So we now go to the field of internal medicine. They say that most this medical doctors are like stuffy, and it's true, because any doctor in the field of internal medicine, that doctor reads very hard. I'm not saying that underrating the other fields, but I tell you, it takes a lot from that person to sit down and read. So for internal medicine, most of their notes are all encompassing. When you read their notes very well, you tend to pass very well. But in as much as you are reading their notes, you need to get other resource texts. Something like when you read, you'll be able to understand, and also it should be the recent edition. There are other books like Kumar and Clark for internal medicine, but I use Davidson. And Davidson, as of then, during my own time when I was in 400 level, I used Davidson, the 24th edition. But at the moment, I tell you, Davidson has 27th edition, which is not even in the market. The only one that is in the market is the 26th edition. That's of Davidson. And there's a lot of differences with the 24th edition. So take worthy of note those that are reading Davidson. If you are reading the 24th edition, I encourage you to also lay your hands on the 26th edition also. So in community medicine is good. Like, I used to see that community medicine, most people don't take people This same doctors in community medicine don't like, yeah, mostly they don't, it's not a field, like it's not a taxing field. But I tell you, community medicine is taxing. It's difficult as well because it's a very vast field. In Apart from being vast, you need to read, and it also takes a lot of calculations like biostatistics, epidemiology, these two are very, very vast, and other fields as well in community medicine. You need to be accustomed with all the fields to be able to pass your exam very well. As of then, I when I entered final year, I was able to lay my hands on PACS. That's PACS textbook of community medicine. But I know that there is the Nigerian authors, there are some that have started producing some books in community medicine as well, which I know once someone uses it, and the person that used it said that most of the questions came out from that text. So I believe the book is good. So I don't know the author, because the person was now like trying to hide the author from me. So I'm sorry to say that, but that was true. So I encourage you all to read PACS. PACS is good. Like when you start reading PACS, like you get whole a lot. Like the wordings that they are not like American in English, that you need to now like crack your brain to understand the English before you even understand what it means. It's not like that. I guess it's British English, so it's like, well, you can be able to read very well and understand facts when you are not like stuck in any parts, but their notes are good also, they are well enough. So these are the advice for the clinical students. I encourage you all to be very hardworking and don't overwork yourself so that you crash, because when you overwork yourself, there is a tendency that you crash, and when you crash, you won't be able to now like continue this race. So it's a race. And now, coming back to the final year medics, the final year medical students, it's not easy. Actually, it's one of the times in my life that I was not like, wow, this is the end road of this whole journey. And you just like you're trying to remember all you've been taught in med school for years. So I tell you, it's not an easy time in your life, because you'll be now like be scared, you'll be filled with happiness as well as anxious and fear, because you now like, oh, I never knew I reached this terminal point, this terminus, and now it has come. But don't be carried away by the time that it has come, but know that you're about to face a battle. I'm not saying to scare you, but it's really a battle. So the exit battle is there. So one of try to attend all clinical activities in as much as you're in the final year, because sometimes when we reach the final bus stop, we say, okay, we must have learned everything, so there's no need for me to attend clinical activities. But that's very, very wrong. Like, if anyone tells you that you should sit down at home and be reading on your own, don't attend clinical activities in final year, that person is a great liar. Like, that one person wants you to really fail. Because if the examiner doesn't see you during ward rounds, during clinics, during calls, he tags you as a very unserious student. So during your final year, you need to participate very well, because I tell you, this even the time that they are very cautious to see what students are doing, to now see their reply, to see their strength, and to see how they'll be able to set their exams, like how they'll be able to now like rate the students. Is during the clinical activities, them, because that's the interactive session, and that's the time that you'll be able to ask questions. So I encourage you all to now like participate in clinical activities during the final year. So even, excuse me, during the clinical activities, that was when one of the HODs was now advising us in our unit that his own exam as the HOD, we need to read Badger, and that Badger, that we need to know the basic principles. That's the first 7 chapters of Badger. I was thinking he was joking, but he was so serious about it, and it came up during the exams. So You read Badger, the first 7 topics, then the other units, that's the urology, the cardiothoracic surgery, the neurosurgery, orthopedics, and the rest. You'll be able to now like read them, like just pick some hints in the textbook. You must have read it over and over during the past years, so it's just like a kind of revision. So I also encourage you to lay your hands on Manipal. Manipal surgery text is like a clinical guide. I read that textbook once. It was during my close like 3 weeks to my final exams that I now realized I got the text. And when I got it online, it really helped me because it's straightforward. It's not like a text that you can just have to maneuver some things there. It's clinicals and it's straightforward. So you need to read it well. Me, I read it like a kind of once, but you can do more. You can read it twice or thrice and go confidently to the exams. So for internal medicine, you need to read them well, like, because internal medicine was one of the difficult exams. Yeah, because the way they twisted the exams, it was to be able to test your knowledge, not only like what you've read once. You need to now like read it in depth, and you cannot be able to survive internal medicine with only notes. I'm not underrating the notes. You can pass internal medicine with the notes, but I encourage you to lay your hands on text also. So during the final exams, you need to get your word quotes. It should be extremely white. Like for me, they say it's showmanship, but it's just like I value their exams. So I got new word quotes. It was white, yeah, pure white. Get your head, simple hair, but it should be neat. So people used to say that, okay, when you are neat during the exam, that means you're not preparing for the exams. I tell you, you need to come out well so that you'll be able to now like speak well. And apart from that, your equipment, get new equipment. You cannot get old equipment and come and saying, okay, you're trying the pen touch, you're trying to the battery. It's going to make you like time is going. Like they say, time is neuron in neurology. So time is going. They time you 15 seconds. So you need to be now like, it's not something that maybe you're before the exam now and you're trying to now like maneuver with the instruments as if it's your first time, and for the past 3 years you've been doing you've been using the pen touch. But for these final exams, the pen touch, the battery, a lot, though I'm not saying that a lot of things doesn't come during the clinical examination. Mine was even like I started crying during the clinical examination. But I tell you, during clinical examination, you need to prove yourself. You need to know that, show them you are ready. And being ready is the way you dress, your hairdo. I'm not saying that a complicated hairstyle. Definitely, if I say a complicated hairstyle on someone, I say, oh, you have all the time in this world to sit down and make a complicated hairstyle during your final exams. So you need to get a simple hairstyle that is neat. Yes, you can do it. Then get your equipment. My own equipment, I make sure they are neat during the exams and they are new. I'm not saying I'm boxed up, no, but I get them new. My equipment is very new. Everything is new. It's not showmanship, but I value these exams and it has worked for me. So you can do well as much as possible. You can do your best. So these few weeks, though is the season, like it's season of holidays, season of love, season of sharing, but I encourage you to read your books. The way I do my own is that when everybody has gone home, when everybody is celebrating, I sit back. That's when the place is so quiet for me. I read very well. Even these 2 weeks, when everybody is coming back, I've been loaded and prepared for the exams. So you need to sit back and read your books, because you can't crash medicine. Nobody crash medicine. You can't crash surgery. It's not done anywhere. So you need to read your books very well if you really want to pass. Then so these 2 weeks, like the first topic, we are going to start with the basic principles, like the basic topics in surgery. Then the next week we are going to go down with all the units in internal medicine. We'll have like separate days from each unit, like cardiology, like what we can see there, and also neurology, pulmonology, gastroenterology, and also nephrology. Then we'll lay our hands on investigations, because during my own time they told us to interpret like investigations form. It was not like seeing it, because you see values, you see it, the SI units, it's like confusing going down to the basis. And apart from that, you need to know their normal ranges, you need to know their aberrations, you need to know what they entails, you know what they interpret, you need to know the implications, you need to be able to now like ascertain the clinical diagnosis, make differentials, be able to start the treatment and management of the patient. It's not easy. So I will be able to lay our hands on investigation forms. We'll be able to go to radiology. How I remember one of my exams, that's not my school exam, but it was an outdoor exams. It was based on radiology, like you see radiographs and you'll be able to now like interpret it and be able to get the diagnosis. It's how taxing it is, but the interpretation was really explicit. It was not just something you pick and just say, okay, this is the diagnosis. You need to go down and interpret it. So it wasn't easy. It ain't easy. So I tell you, you need to be able to read very well. So we'll be able, this 2 weeks, this little time we have, we will lay our hands on each of these. So, and some materials I'll be sharing also, it's going to help, because like in as much as I read textbook, I read notes, I attend emergency units, yes, I go for calls, I go for ward rounds, grand rounds, and teaching rounds, and also morning meetings. That is not enough. You need to go for question bank. I remember that I had to go to buy questions, like banks of questions. You need to test yourself. I tell you, most of the examination is not like it's not a first slap. No, I don't want to use the word slap, but you need to be slapped many times before you be able to pass this final slapping. So you need to get your hands on question bank. Try to test yourself. This reading that I'm doing, and will I be able to pass other exams? You need to test yourself. It's not something that you try 100 questions and come and sit down, or you try 500 questions and come and sit down and say, Kai, this medicine, I can pass it. No, you need to go down to thousands of questions. Limit your time. How can I be able to answer this question in seconds and get the diagnosis right? If I'm being pushed to answer difficult questions, how am I going to do? You have to test yourself before coming to the final exam and say, okay, I want to write the final examination. So do your best. You need to put your best. That's why when people say, okay, I overdo things, I'm always like, they are celebrating Christmas and I'm in my read. I say yes, because I know what I'm going to face in the future, these exams. So when you don't pass the exams, it's like, it's another year, and another year. It's not only the sacrifice, and you don't even think of what you're going to the time, but you think of the efforts you put in and how you're going to now like start afresh. It's not easy. It's not an easy route. So just try your best. Try your best and sit back and read. Lay your hands on question banks on studycool.com. There are other channels. There are other platforms which like Scribe to do their best. Sometimes they require some payments in dollars. Sometimes they require some documents you need to make. I had to make questions and documents to be able to now like procure some question banks from Scribe and studycool.com. I have to do that to be able to now like pass. I'm not saying that it was Chokes or Expo, but I have to now like get question banks, test yourself. Test, okay, outside the bounds of this med school, will I be able to cope out in the outside world with other exams? Some of us like are fortunate to be now writing other international exams like USMLE, like PLAB and others, and the NEET PG. It's not an easy exam. So some of us like are well accustomed with those exams. So when you now like test yourself in other exams, you're able to know yourself, rate yourself, and know where you place yourself. So I wish you all the very best, and I tell you that we'll flow well, and I encourage you to read very well before each tutorial. I'll set the timetable, and I want it to be like interactive. When you participate very well and interact very well, it will help us all. I wish you all the very best. Compliment of the season and read well. Thank you so much.